Can poor posture cause chest pain? Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain how poor posture can cause chest pain, as well as some various solutions that you can use to relieve chest pain if it is coming from poor posture. Now, the first thing you should do if you have chest pain, particularly if it's left-sided chest pain, is to make sure that you're not having a heart attack. So if the pain came on suddenly, or if it feels like there's an elephant sitting on your chest, if you have never had chest pain before and this suddenly comes on sharply with no reason that you know of, if it gets worse with physical exertion, like walking around, or if you otherwise just feel like something's not right, then stop watching the video, call the hospital, or better yet, just go to the ER and get things checked out, because you don't want to have a heart attack thinking that it's some sort of mechanical muscle or rib problem. But there are a lot of non-serious things that can cause chest pain, and poor posture can cause many of those different types of problems. So I'm going to review what some of those things are and then go through each one by one, as well as some tips and solutions you can use to relieve your chest pain if it is coming from poor posture. And so the couple things that can cause chest pain from poor posture are a rib dysfunction, where one of your ribs or costal cartilages is kind of pushed out forward or pushed backwards a little bit. The second part is a stiff scalene muscle in your neck that's running down this way, that the scalenes kind of radiate pain down into your chest and sometimes down into your arms as well. And additionally, it can be from a herniated disc in your thoracic spine or in your upper back. So those are the three main causes of chest pain if you do have, if it is coming from poor posture. So first of all, let's talk about the rib dysfunction. That's probably the most common thing. Let's say you're out hitting golf balls or something like that, or you're doing something mechanical and active with your arms, and you notice, hey, my chest doesn't feel really good. Or you're sitting with poor posture and sitting tight like that, and you notice you feel like something kind of off in your chest and also at the same corresponding level in your lower back. That may be a rib dysfunction. And the ribs join together at your costal cartilages here at your sternum, as well as in the back. And when a rib kind of gets pushed either too far forward or too far back, it can put a strain on those costal cartilages, commonly known as costochondritis, where the costal cartilages get a little bit inflamed or just mechanically stretched in a way that they normally shouldn't, and that can cause a symptom of chest pain. You may notice increased pain if you have costochondritis. If you're taking a really deep breath and expanding your chest, that may be something that's painful. Or if you're sick and you're coughing, you may notice that you have a little bit of pain in your costochondral area or in your chest. And so what can you do if you do have chest pain from poor posture, from costochondritis? So one thing you can do is just putting pressure on that area, particularly if you run your fingers down the inside of your rib cage and you feel one area that's just kind of pushed out forward a little bit more than another one. If you put your hands right there and kind of push on it, and then take a few deep breaths. That helps push the rib that is currently pushed out forward a little bit backwards, while the rest of your ribs are kind of expanding out forward when you take the deep breaths. Now, if you run your fingers down your rib cage and the sore one is set back a little bit, then you'll actually need to put pressure up against your back. And you can do that standing up against a door frame or have someone else put some pressure on your back as you're taking deep breaths in and out. And that's something we commonly do in physical therapy. That's one treatment for a rib problem. Manipulation is another good treatment that we can do in physical therapy. But just doing some breathing techniques like that is a good way to reset a rib dysfunction if that's what's causing your chest pain from sitting with poor posture. So that's the first thing, is the rib dysfunction. Now, what about stiffness in your scalene muscles? If you sit with your head out like that, or head forward like that as you're working at a desk or typing on a computer, that can put stress on your muscles, particularly your sternocleidomastoid muscles right here and your scalene muscles if you sniff, you can see them kind of flare out like that. Those are called your scalene muscles. And your scalenes, when you look at them on a trigger point diagram, their referral pattern is in the neck, as well as kind of down into the upper part of the chest right there, and then down into the arm as well. So if you're having chest pain just in this upper part of the chest, and again, you've ruled out a heart attack, and you think it may just be from sitting with poor posture like that, well, obviously you want to correct your posture, keep your chin over your shoulders, and not have your head forward like that, because that's going to put less strain on the neck muscles when your spine is supporting your head instead of your muscles having to work to support the weight of your head. So fixing your posture and sitting with your head above your shoulders where it's stacked vertically over your spine and your spine's doing most of the work of holding your head up, as it should, then that's one good solution. Additionally, you can do stretches for these muscles if they've gotten stiff and overworked. But I've got another video that I can link to that shows a more specific stretch on how to stretch your scalenes. But they attach into your first rib, which sits right near your collarbone. And so if you're stretching your head over like that, but you're not holding that first rib down, it's just going to yank the first rib up even further. So you'll want to have a towel or a belt or something that you put over your shoulder and kind of pull down that way as you're stretching your neck over. And that holds the first rib down while you stretch your neck muscles. And again, I'll link to a different video that shows the exact technique on how to do that. But that's a stretch for your scalenes if your scalenes are causing your chest pain. Now, finally, what about your thoracic spine? That a herniated disc in your thoracic spine, one of the major symptoms of a herniated thoracic disc is chest pain or pain that radiates around the rib cage into your chest. And so if you have a herniated thoracic disc, it can be aggravated either by slouching too much, or in some cases, your thoracic spine is actually supposed to be a little bit rounded. So if you're sitting up too much upright, that can narrow the spaces where the nerves come out in your thoracic spine and further pinch the nerve. So you have to play with your position a little bit to find out which one is causing your problem. If sitting up a little bit straighter relieves your chest pain, then do that. If slouching down a little bit more relieves your chest pain, do that, even though that's not what people refer to as good posture. But if it helps relieve the symptom that you have a problem with, then that's the best posture for you. So those are the three things that can cause chest pain from poor posture. And again, those are a rib dysfunction, scalene dysfunction, or a thoracic radiculopathy or a pinched nerve in your thoracic spine or in your upper back. Now, if you do need some more help for mechanical chest pain, and again, you must rule out that you're not having a heart attack. But if you do need some help for mechanical chest pain, for example, from a rib dysfunction, or if you think you may have a pinched nerve in your thoracic spine, then we'd be happy to help you out at More for Life. Just give us a call if you're in the St. Louis area, and we'll get you booked in for an appointment and help you figure out what's causing your problem, as well as what you can do to relieve it. And if you found this video helpful, then give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and have a great day.